Coming to PET scan, that is PET scan, which is a emission tomography. So it is FDG PET for viability. It is based on the fact that myocardium utilizes glucose for metabolism when under effect of ischemia. So normally at normal circumstances, normally for energy, myocardium uses fatty acids. But during the stress test or during ischemia, it utilizes glucose. Non-viable myocardium will not show any uptake. Non-viable myocardium will not show any uptake. Whereas if you give glucose, the infarcted, the ischemia part will take uptake. Ischemia part will take, glucose will take an uptake. PET viability is unique modality in its ability to evaluate myocardial tissues myocardial glucose metabolism. So it assesses both the perfusion as well as the metabolic activity. At rest, healthy myocardium oxidizes free fatty acids to produce ATP. So at rest, normal myocardium uses free fatty acids. But in the setting of myocardial ischemia, there would be a shift of hibernating myocardial metabolism from fatty acids to glucose. So from the fatty acids, the tissue goes to glucose with upregulation of glucose transporter. For optimal FDG uptake of viable myocardium, it is crucial to stimulate endogenous insulin release. So FDG uptake, so suppose FDG uptake has to occur, there should be an endogenous insulin release should happen, and also you should maintain glucose levels between 100 to 140 levels before injecting FDG levels. Otherwise, there may be false readings may occur. PET imaging is performed after 45 to 90 minutes after injecting approximately 7 millisieverts of F18 FDG. Myocardial uptake of FDG continues to increase and blood activity decrease even after 45 minutes. Waiting 90 minutes after the injection of FDG may give better signal to noise ratio as the blood pool has less FDG. The typical scan duration is typically how much minutes? It's 10 to 30 minutes. So at perfusion tracer, you give perfusion tracer, perfusion imaging is done, then you give glucose there, manipulation, then you give glucose and you check for metabolic activity. So in patterns of perfusion, so because the PET assess both perfusion as well as the metabolic activity, if any tissue of myocardium has a normal perfusion and normal FDG, it means it is healthy myocardium. Suppose if it is abnormal perfusion and abnormal FDG, that means it is presence of myocardial scar. Suppose there is abnormal perfusion and normal perfusion is abnormal, but if it is normal 18 FDG uptake, that means it is abnormal mismatch, or it could be because of hibernating myocardium where there is perfusion is defect, but the myocardium is still preserved. Unless it can be normal perfusion and low FDG uptake, reverse mismatch of adequately perfused myocardium metabolizing fatty acid rather than glucose. So this condition can be seen in if suppose myocardium is not using glucose but it is using fatty acids. So it will not use F18 FDG, then there will be low FDG uptake, whereas normal perfusion is maintained. So you can see here you can see there is perfusion is decreased in the anterior and as well as septum part, whereas perfusion decreased but metabolism is maintained here. You can see here metabolism FDG uptake is normal in that area. So it means that the tissue is viable. You can see in hibernating myocardium, you can see. You can see a scar tissue, there is no perfusion as well as no metabolism uptake can be seen. Here inferior ball, you can see here there is perfusion is defective, whereas the metabolism is maintained. It can be seen in hibernating myocardium. So if perfusion is preserved, glucose metabolism is preserved, that means tissue is viable. If perfusion is reduced, glucose metabolism is preserved. That means it could be either mismatch, mainly seen in viable hibernation. If both are reduced, it is non-viable. If perfusion is preserved but the glucose metabolism is reduced, that means it is reverse mismatch. You can see here again, there is mismatch defect in the lateral wall. So uptake of metabolic activity is present, but perfusion is not there.